Skin spots, brittle nails, non-healing wounds. These signs could be your body's warning of serious health problems. Are you ready to discover what your skin is trying to say about your overall health? Like and subscribe to our channel. Each like and subscription helps us bring you more quality health content. Your participation makes the difference. The skin, the largest organ of the human body, plays a crucial role not only as a protective barrier, but also as an indicator of our internal health. Changes in the skin, such as spots, texture, or color alterations, and sensitivity can be the first visible signs of underlying health conditions. Observing these changes can be essential for the early diagnosis and effective treatment of various diseases, highlighting the importance of paying attention not only to what we feel, but also to what we can see on our skin. Thus, the skin functions as a map, reflecting the state of our overall health, and understanding its signals is fundamental to maintaining our well-being. Reddish or purplish spots on the skin, known as purpura, can be alarming indicators of blood disorders. These spots often result from bleeding under the skin, which can occur due to various conditions such as low platelet count, clotting disorders, or vasculitis. In some cases, purpura is not just a localized problem, but can be a symptom of more serious conditions like leukemia or other blood diseases. Therefore, it is essential not to ignore these signs and to consult a doctor for proper investigation, as early diagnosis can be crucial for effective treatment. Excessively dry or flaky skin can be more than just a minor inconvenience. Often, these conditions are revealing signs of deeper health issues, such as hypothyroidism or nutritional deficiencies. Hypothyroidism, a condition where the thyroid gland does not produce enough hormones, can slow down metabolism and reduce skin cell renewal, leading to dryness and flaking. Additionally, deficiencies in essential vitamins and minerals, such as vitamins A, B, and E, and zinc, can directly affect skin health, compromising its ability to stay hydrated and repair damage. Therefore, persistent changes in skin texture should be evaluated by a healthcare professional to ensure proper treatment of underlying causes. Jaundice, characterized by a yellowish coloration of the skin and eyes, is a significant clinical sign that can indicate serious health problems, especially related to the liver. This yellowing occurs due to the accumulation of bilirubin, a byproduct of the breakdown of red blood cells, which is normally processed by the liver. When the liver is damaged or overwhelmed, as in conditions like hepatitis, cirrhosis, or biliary obstruction, it can fail to eliminate bilirubin properly, leading to the development of jaundice. This sign is a strong indicator that a detailed medical evaluation is necessary to identify and treat the underlying cause, thus preventing more serious complications. Skin rashes accompanied by swelling can be important manifestations of autoimmune diseases or allergic reactions. In the context of autoimmune diseases like lupus or psoriasis, the immune system mistakenly attacks healthy skin cells, resulting in visible inflammation and discomfort. On the other hand, allergic reactions, whether to foods, medications, or other environmental allergens, can also cause rashes as an immediate response of the body to the allergen. These rashes are usually a warning sign that the body is fighting against a perceived harmful substance, and their recognition and appropriate treatment are crucial to avoid more severe complications and improve the patient's quality of life. Frequent hives, characterized by raised and often itchy patches on the skin, can indicate severe allergic reactions or chronic health problems. In many cases, these eruptions are responses to specific allergens and may be accompanied by more severe symptoms like difficulty breathing or angioedema, requiring immediate medical intervention. Additionally, the continuous presence of hives may also signal more complex underlying conditions, such as autoimmune disorders or even chronic infections. Therefore, it is crucial that individuals with recurrent episodes of hives seek medical evaluation to determine the underlying cause and receive appropriate treatment, thus avoiding future complications. Changes in the color and texture of nails can be more than just aesthetic issues. Often, they are windows into a person's internal health. Pale or white nails can indicate anemia, while yellowish nails can be a sign of fungal infections or liver diseases. Additionally, bluish nails may suggest blood oxygenation problems, and dark lines under the nails can be a worrying sign of melanoma. The texture of nails also provides clues about health conditions. Brittle or grooved nails can be associated with nutritional deficiencies, such as lack of iron, zinc, or B vitamins. Extremely thick nails, or those that curve outward, known as clubbing, can indicate chronic respiratory diseases. Observing these changes and seeking medical evaluation can be crucial to identifying and treating underlying health problems before they progress to more serious conditions. Non-healing wounds are a concerning symptom that should not be ignored, as they can indicate serious underlying medical conditions, such as diabetes or circulation problems. In the case of diabetes, high blood glucose levels can impair the body's ability to heal, resulting in slow healing and an increased risk of infections. Additionally, diabetic neuropathy, a common complication causing nerve damage, can prevent patients from feeling pain in wounds, delaying the search for treatment and potentially leading to more serious complications. Circulation problems are also a common cause of non-healing wounds, especially in the lower extremities. Conditions such as chronic venous insufficiency and peripheral arterial disease limit blood flow to certain areas of the body, making it difficult to deliver the oxygen and essential nutrients needed for healing. If wounds persist for a prolonged period without signs of improvement, it is crucial to seek immediate medical evaluation. Identifying and treating the underlying cause of these wounds is essential to preventing future complications and improving quality of life. Sudden skin lesions without an apparent cause of physical trauma can be alarming and are often indicative of underlying medical conditions that require attention. These lesions can manifest as bruises, spots, or even small ruptures or hemorrhages in the skin, appearing without a known impact or injury incident. Such occurrences can be signs of coagulation disorders or conditions affecting blood vessel fragility, such as certain autoimmune diseases, vitamin deficiencies, or the use of anticoagulant medications. Additionally, lesions without an obvious cause can also indicate more serious problems, such as hematological disorders, including leukemia or other forms of cancer. In some cases, these marks may be the result of an underlying infection that causes inflammation and capillary fragility. It is essential not to ignore these signs and seek medical evaluation to determine the root cause and initiate appropriate treatment. Early diagnosis of these conditions can be crucial to avoiding more severe complications and for effective long-term health management. Hormonal changes are a common cause of acne and other skin changes, often reflecting imbalances or problems in the endocrine system. During periods such as puberty, pregnancy, menopause, or due to conditions like polycystic ovary syndrome, PCOS, fluctuations in hormone levels can increase sebum production by the sebaceous glands, leading to clogged pores and the appearance of acne. Additionally, hormones like androgens, when in elevated levels, can exacerbate these effects, causing not only acne but also other skin problems, such as excessive oiliness or dry skin. Other endocrine changes, such as thyroid gland problems, can also manifest through the skin. Hypothyroidism can result in dry skin, while hyperthyroidism can cause moist and warm skin. These changes are not just symptomatic. They signal underlying imbalances that can have serious implications for overall health. Therefore, it is important that persistent skin changes be evaluated by a doctor who can investigate possible underlying hormonal disorders and provide targeted treatment to not only improve skin condition, but also the individual's overall health. Increased sun sensitivity, also known as photosensitivity, can be indicative of various medical conditions, including disorders such as porphyria and lupus. Porphyria is a group of rare disorders related to heme metabolism, where certain chemicals that are normally harmless become sensitive to light, causing significant skin damage when exposed to the sun. Symptoms can include intense pain, swelling, and redness in exposed areas. On the other hand, lupus is a chronic autoimmune disease that can also trigger photosensitivity. In this case, sun exposure can trigger or worsen skin rashes and contribute to the activation of symptoms in other organs. Besides porphyria and lupus, other conditions like phototoxic reactions to certain medications or cosmetics can also cause sun sensitivity. Common medications such as certain antibiotics and anti-inflammatories can increase the skin's sensitivity to UV light, resulting in faster and more severe sunburns than usual. It is essential that individuals with photosensitivity take additional precautions, such as using broad-spectrum sunscreen, wearing protective clothing, and limiting sun exposure during peak hours to minimize the risks of skin damage and exacerbation of symptoms related to their underlying condition. Careful observation of skin changes can provide critical clues about overall health, as conditions like purpura, jaundice, skin rashes, and photosensitivity can indicate serious medical problems, including autoimmune disorders, hormonal imbalances, and blood diseases. Therefore, it is crucial not to ignore these changes and seek medical advice promptly. Early diagnosis and appropriate treatment not only help resolve dermatological symptoms, but can also be decisive for the patient's overall health, preventing complications that can be much more severe. Thus, when noticing any of the discussed signs, it is essential to consult a doctor for a detailed evaluation and professional guidance. So, have you noticed any of these signs on your skin? Do not underestimate what your body is trying to say. Skin changes can be the first alert of something more serious happening inside. Stay alert and do not hesitate to seek medical advice. Subscribe to the channel, activate the notification bell to not miss anything, and tell me in the comments. Have you ever had any of these conditions? How was your experience? Let's learn more about our health and well-being together.